Okay. Hi and welcome to Synapse. This is Dr. Sonika, JR3 General Surgery resident. So, in today's Synapse video, I'll be sharing my experience and how I have seen my colleagues go through their residency. Okay. So, this is not some kind of a teaching or an educational type of a video. So, it is just going to be an informal chit chat kind of a video where I will express my views and I'm going to tell about my experiences during throughout my residency. So now that the NEET exam is over, now that the counseling is already started, many of you might have already got your seats allotted, and many of you will very soon, and you'll be joining your course. So I remember being in this position 2 years 3 years back, when I gave my NEET PG. It was in 2019. So I really understand. I can like relate to the state of mind of the students who are appearing for the counseling right now. It's just that you are extremely happy, so you had a dream of clearing the exam and getting a seat in a particular college, let's say, or a particular department. Okay, so now that that has come true, you wouldn't have seen anything beyond that. Okay, so that is something that made me make this video in first place. So when I cleared my exam, and I was extremely happy. I wanted general surgery and I got general surgery. I am right now doing my general surgery in Karnataka, so I didn't want to go out of the state, and I got in a government college where you get good cutting chances. So I was happy. My parents were also very happy for me. So, but what happened is nobody told me about residency. Okay, so you're in that happy merry place. This video is just to tell you like what lies ahead. Okay, making you mentally prepared for what is about to come. I'm not going to sugarcoat anything. Okay, and it is just, I'm just sharing my experience. Okay, things that I learned from, let's say, my mistakes, or just that certain norms that you're expected to know as a resident. Okay, so that's it. This video is not to scare anybody. Okay, it is just expressing things that I learned, making, let's say, the path easier for the guys who are coming into residency right now. Okay, so if you feel you might relate to this video very well, or in a better way. Once you get into residency, you come up when you come up with situations, or you place yourself in the position that I am describing right now, the whole thing makes sense. Okay, so let's get started. This is a very informal video. This is not at all scripted, and I have just jotted down a few points, okay, that I will be considering taking, and then saying whatever my experience was with it. So the first thing is, see, post graduation is a 3 years course, correct? So it requires 100% of your commitment. Okay, one, that is expected of you by your seniors, your staff, the people who supervise you. And two, it is something that you need to put in. Okay, it's required for you as well, because see, you, whatever you're going to learn in that particular subject, that's what you're going to do in the period of 3 years. After that, once you become a consultant, nobody teaches you the basics. Okay, so now is the time to master it. Like, say for example, general surgery. So there are a lot of procedures, a lot of reading that you have to do from the books, and a lot of skills that you have to acquire to carry on your general surgery practice once you're done with your MS. So for all of that, you have only 3 years. So do not waste your time. It's always better to remain true to the course. Come what may, keep reading, just keep doing whatever you have to do as per the curriculum, because you have only limited time. Okay, that is only 3 years. And next is see, you got to like the course, okay? So otherwise anything and everything becomes a pain, okay? You don't like what you're doing, obviously you will not get the results. So many of you might have got the course of your choice, okay? I'm extremely happy for you guys, congratulations. But there are there are others who have got a seat, probably not, your first choice. Let's say you wanted uh, uh, general medicine, and then you end up getting ENT or after or something like that. So first thing is to like what you're doing, okay? Even if you got a branch that you did not intend to, there is nothing like a branch is boring. So every branch is important, okay? Every branch has cool stuff, okay? So you need to start liking what you're doing. Fine. So you talk to your seniors who are in that department or that practice right now. You can ask your consultants, so that you get inspired and you get to you start liking what do. So that is the most important thing. And next is, see, as a JR1, now you coming into a system. So there is a hierarchy, right? So the consultant, then comes your junior staff, which will be your associate, then comes your assistant professor, then your SRs, that is your senior resident, then you have your JR3, JR2, JR1. So you are going to enter the system at the JR1 level. Okay, so there of course you are going to be the junior most. Okay, under you, yes, there are interns, but interns are not, they are never questioned. Okay, so they do their job, they're happy, they're after that they leave. Okay, so you are the ones who is going to take all the responsibility of the system. So you're obviously burdened with a lot of work, okay? May it be physical work, taking care of your patients, doing the dressings, doing the ward works, the paperwork, again, writing your case sheets, clearing the case sheets, keeping a lot of records as well, okay? So all of these, and also your OT work, shifting the patient, making the patient fit for the OT, doing all the pre-anesthetic workup, so taking opinions. So all this happens to be the GR1's work. Okay, so let me just clearly tell the distribution of work. So JR1 is doing all the rut work. He's running around. I don't know if you watched The Good Doctor, but yes, our lives are pretty much like it. Okay, so especially true for a surgical field. So you're doing all the rut work, you're running around, and yet you don't get to do any OTs, you don't get to do the cool stuff. Okay, so once you become JR2, in now you start getting the minor procedures. You start doing appendicectomies, you start getting hernias, you start doing your INDs and all those things. Okay, so you are starting to do the simple procedures, and you get some time to read. So a JR1 almost doesn't get any time to read. If you do, yes, squeeze in the time, keep certain books handy in between your, let's say, rounds or like your ward work. So whenever you get time, always have a pocket book or keep a book in the hospital which you can easily access and read up whenever you get the time. Okay, that's the best way of working during the first year. And always in your first year, do not go to read the standard books. Okay, read the practical books, things that will help in your clinics. It might be books on how to dress the patient, okay, how to take proper wound care, or it could be things like how to manage a patient in the ICU, your fluid requirements, how to titrate the fluid, and how to manage a patient when he comes in upper GI bleed, what will be the dosage of the medications, how to insert central line, how to insert ICDs, proper catheterization procedures, how to secure cannula, blood drawing. So these are the things that you need to master during your first year. Okay, if you've done this during your internship, great. But if not, okay, you have to master these in your first year, because after this you will not get the time and the opportunity to do this, and you should be in a position to teach your juniors, okay, once you become JR2 or JR3. So you don't have the opportunity to learn these things later on. Okay, that is what you're going to master during the JR1. If you don't get time to study, do not worry, because when I was in JR1, like I was a person who should read something daily. Only then I would be like, okay, I have learned something today and I will feel satisfied. But in JR1, hardly got any time to study. So don't be disheartened, and that's the way things work. okay. You don't get time, it's totally fine. You just do the clinical work, okay. Do master your ward work. And then in your JR2 you start getting some time, then you open your standard textbook, you start opening your Bailey and Love, Schwartz, Sebastian, Mango. So these are all, you open your standard books, okay, and you start reading in your JR2. In JR3 obviously you're giving your rounds, you're assisting your consultant who'll start being being his first assistant. So there is a lot of responsibility on you, you're managing the whole unit. And you will be, soon exam going, so then you will start working on your thesis and on your exams. So this is how the system actually works. So what I meant to say is JR1 is doing most of the physical work, okay. He is doing all the taxing work in the ward, in the OT, running around, shifting the patient. All of this is fine, okay. So don't get disheartened, your chance will come, you will get your cutting, you will get your OTs, you will get, get to do all the cool stuff once you come into your JR2. And obviously you will have to do your duties. If it's a surgery department, orthopedics, trauma or something like that, obviously you have to be on call, you will be a little more busy as compared to the paraclinical departments. And so you'll have to work day and night, so basically you'll be on call for 24 hours. Depending on the number of units in your hospital, you might get one duty per week or two duties per week, it depends, okay. So duty days, you will have to be in the hospital, there's no other way around, you are working on the clock. So next thing is about your health, okay. So while you do all of this, again, this is what is expected of you and what you are supposed to be doing. So you'll be doing all of this, at the same time you need to take care of your health, because if not for you, there's nobody else who is taking care of you, okay. And residency is a different phase of your life, okay. So all the, fun, what do you call it, I'm not getting the right word for it. So basically all the bachpana days are gone, okay. So now you're, let's say, 25 plus, you are getting your stipend. Now you need to manage your finances as well, you need to take care of your studies, your rent if you're staying outside, like I am staying in a house outside. If you're in the hostel, no problem, you need to take care of your food, your travel, all your other expenses. So now this is, you're entered a phase wherein you have, basically the adulting has begun and you're taking charge of your life. There are a lot of responsibilities. For some it might also be like you need to take care of your parents, okay, or finances at home, or some already have the commitment of family, some are already married. So there are a lot of things on your mind, and it's all about balancing it right. And what I was saying is, you need to eat right, okay. So you can't just skip meals and be like, okay, I didn't get time today, I'm not going to have my lunch, or I'll skip my breakfast. It is going to take a toll on your health, okay, because I did it, and I lost half my weight in first year, and all the buckle pad of fat and everything had gone. It took some time, and then I have put on good amount of weight right now that I've become a senior. So it is normal for a JR1 to lose weight, work hard in the wards. It's totally fine, but always eat healthy, don't miss your meals, keep some snacks in your pocket, keep some dry fruits or sneaker bar or something you keep in your pocket. So whenever you get time, you're hungry in between rounds, when you're running around in the ward, just have a little bit of whatever is there in your pocket, if not for a proper meal, okay. So that's that. And then that's about your physical health, but let's come to mental health, okay. This is a very very important and a sensitive issue as well. There are a number of instances that you might have heard in the news or read in the papers about the harassment and the bullying that the postgraduates, the juniors usually face in the medical college once they join the course. So all of that exists, okay. So um, I don't know how to say this. There is some amount of, see, your seniors are there. Okay, so once you enter, they are going to help you with your ward work, with your studies. Whatever help is possible, they will provide, but at the same time they want you to do the work. Okay, so some might say it nicely, but some might not, be so nice to you or kind to you, because maybe things were not so the situations were not kind enough for them. So some just merely happen to treat you the way they were treated. Okay, so what I'm trying to say is, don't judge that person. Okay, so they're your seniors, so they might be harsh at times, they might use wrong words, they might just be angry with you, and there might be some amount of mental tension. Okay, or that's hope that's the right word. So because I have also gone through this, and I used to feel bad at that moment, during that period, and always have a friend or a family with whom you can share this. Okay, so that you don't carry it forward to the next day. You come back, you just call your friend, a close friend, or call your sister or your mother, or whoever you're close with. Just say that, share the matter with them, and just forget it. Okay, so the more you carry on, the more you get affected. Okay, you are there to learn something. You're gone there to get your degree. Okay, you're going to study, you're going to learn new skills. You don't have to be upset because somebody else's behavior. That's what I'm trying to say. I hope you get it. Once you get into the course, you come across a situation like that, then this video makes more sense. That's what I said in the beginning as well. Okay, hope you don't get circumstances like this, but this is just like preparing for what is coming ahead. Okay, doesn't mean it happens to everybody, but you should know how to deal with it. Okay, always speak to someone with whom you're close. Okay, and also, this is totally your personal choice. Okay, because I think marriage is an added commitment at this point of time, where you're going to give your 3 years working, you're physically tired, you're mentally drained, you're studying, you're burdened with your thesis, and everything. Marriage is an added commitment, but if you think it's different for different people. It just depends on their way of thinking. If your family supports it and everything, then just go ahead. You can have a personal life, get married, but majority of them don't, and as I just said, it is just added responsibility again. And I think I've already spoken about studies, how to go about it. If you don't get to read in JR1, it's okay, it's fine, that's how things are. You will end up covering them, or you should start studying in your second year and your third year post graduation. And lastly, about your thesis. Okay, so it is a must. So if you're doing MDMS, you need to submit your research work. Okay, so the process of research actually starts from first year. So you need to submit what is known as a synopsis or a proposal of your thesis to the university, where they're going to approve. So basically, you'll be allotted a guide. Most commonly, he'll be the unit chief. So and in you're going to sit and you're going to search through a lot of literature, find out the topic that you are interested in and the topic that is feasible, and the kind of topic that has an impact on management of patients in your particular setup. Okay, so such kind of a topic, you are going to sit with your guide, decide, and prepare a proposal, send it to the university. Once accepted, you will start with your thesis work, and at the end of your third year you have to submit it. Okay, so now about research synapse, we are going to come up with a series of videos on research, right from what is research, how to come about with a topic, how to carry on the research, about the analysis and results, and how to publish your research. So all of this is a very important aspect of a medical student's career. Okay, so or the journey. So every medical student should know about research, should try their hand at research. Okay, and now that CVs, basically when you do your PLAB, MRCS, MRCP bar, USMLE. So they're all asking you about your CV. So there are different sections in your curriculum vitae where you talk about your academics, research, publications, extracurriculars, and all of this. So obviously people who do research and who have got publications are considered given an upper hand in kind of interviews and getting the seats in their university of their choice. So it is an important aspect. So we will deal about this in a separate set of videos that we'll make on research and basically break it down, make it very simple for medical students to follow. Okay, so make sure to subscribe to our channel and hit on the bell icon. Whenever we make those videos, you'll be able to get a notification. And lastly, it's about let's say friends. Okay, so you might have had experience that in your undergraduation you have a lot of friends. Okay, you had a number of friends in your hostel, or if you're a localite, yes, you had a lot of time to go around, you spent time chilling, watching movies and so on. So you are more close to your undergraduate friends. So when you come into post graduation, what happens? There are lesser number of people. One, they are from different backgrounds, they might be of different age groups, so you might not get friends having this similar frequency as you. Okay, so you don't call them friends, you can call them colleagues. If you do get amazing friends in your post graduation, very lucky for you. Okay, with the same frequency and everything matching, you are in for luck. So but majority of them don't, so it's totally fine. Post graduation life is all about helping and finishing your uh, course, learning the skills, acquiring the skill set and knowledge, and coming up. Obviously you're not going to stay there forever, so even if you don't have good friends, it's okay, call your UG friends. Okay, have a good relationship with them. And the last thing I want to share about my personal experience is about the me time. Okay, see, I love making YouTube videos, editing videos, and reading a lot of books. I have a different set of let's say hobbies that I love doing before joining my post graduation. So once you get into residency, you are too busy to follow or to do things or follow up your hobbies, so you might not get time to do all of that, so your me time is less. But whenever you get time, make sure you sit, you relax, you unwind, you do meditation or have a nice little spa for yourself. So basically you spend time on rejuvenating yourself and making yourself again be back on your toes to go to your ward and start doing work. So you will not get a lot of time if you're, let's say, a painter or a dancer or someone who makes videos like me. That's the very reason why, like, after I joined the course, you might see from 2019 to 2021 somewhere, the number of videos that I posted were very low or might be like almost nil. So it's because I could not make out time. It's fine, it's just 1 to 2 years of your time that you're going to give to residency as compared to all the time that you have left once you're done. That is the time you're going to spend working on yourself, acquiring skills, as I just mentioned. Just do it. After that, you will have the rest of the life to do whatever you like doing. Okay, so whenever you find me time, just spend it on yourself. Make sure your mental health is right. Okay, as in when you feel that you need help, you need to talk to somebody, make sure you talk to your close friends, or your family. Do not let it be inside you, and don't let it affect your state of mind. Really not worth it. And yeah, that's it. That's my experience. I'll be giving my exam in another 2 to 3 months. I'll be finishing my residency. So that was my experience. I hope this really helps those who are entering their residency right now. Hope you have a great time. Love your course. Love what you're doing. Difference of opinion do exist between, let's say, you, your colleagues, your seniors. Just learn to, you know, what do you call it? Respect their point of view. Don't raise your voice against your seniors. Yes, if they're doing something extremely wrong, terribly wrong, hurting you, then yes, you need to speak up. Otherwise, understand their point of view as to why they are saying it. You know, yeah, they will be of help to you. They will teach you. They will help you out in situations where you don't know what to do. Okay, they might help you out with your thesis. They could help you out with your classes, seminars, OTs, emergency OTs. That's when you kind of learn from your seniors at all. You look at them, the way they speak to the patient, treat the patient, do the OTs or something. So all of that is important. Okay, everybody has goods and bads. So you look at the good portion of them, the things that they're good at, inculcate them, leave the rest. Okay, don't bother about it. You're not here to change anybody.
It's 8
You're just
o'clock.
here to take your degree, finish your course, learn the skills, and move out of that place. Okay, so that is it. I hope you don't take this video in a matter that, okay, I'm trying to scare you. No, this is not that kind of a video. This is just to prime you guys as to what lies ahead. I wish all the very best to all those students who are taking up this seat this year. Okay, and hope you have a great time and get the seat of your choice. Okay, all the very best.